Hello, my name is Mark Ashola and I'm a student nurse. I'm going to be performing a total assessment and my student ID is 105 700223. Here's my student ID. Okay, so now I'm going to put it in the drawer. Okay. So prior to starting, I'm going to perform hand hygiene. Wipe my stat. I'm going to don my gloves. Now I'm going to scan the room. Floor. So now I'm ready to perform my digital assessment. Hello, my name is Mark. I'm a student nurse for today, and I'm going to perform my digital assessment on you. Is that okay?
Okay.
So, do you have any need to use a washroom? Are you feeling anything?
No, I'm good.
Okay. So let's say we have a drape. So I'm gonna assess for the privacy of the patient. So now, may I please get your name, your date of birth, as I check your wristband?
My name is William Overton and I was born in July 28, 1938.
Okay, good. So now I'm gonna assess for the general survey. Patient skin color is consistent with the patient's genetic background, and as well as the age is appropriate to the development of the patient's body. Now I'm gonna assess for the overall body structure of the patient. Patient's body is symmetrical all around. Um, there's no any deformities, muscle deformities noted. So can you please stand up for me? Okay, sit back down. Patient's height is according to his age and genetic background. And when he stands up, his position is erect, which is good. So I'm gonna assess for his behavior. So patient is able to maintain eye contact with the nurse. He seems to be well groomed. Patient is dressed appropriate for the weather, and his mood or facial expression seems to be neutral. So can you please state your name again, and then where you are and today's date?
William Overton and I'm in the hospital right now and today is July 28, 2023.
So upon the question, he is alert and oriented. There's no any working or breathing noted. His breathing is relaxed. So I'm gonna start with the head. So upon inspection of the head is normocephalic. It is symmetrically and round, and the skin color is consistent with the patient's background and the body. Now I'm gonna assess for the face. So can you please smile, frown, raise up your eyebrows? Can you close your eyes tight? And then you show your teeth. Okay. So now I'm gonna assess for the cranial nerve number 7, facial nerve. So can you please puff your cheeks and keep it closed, okay? Puff your cheeks again. Okay, can you close your eyes and try to keep it closed as I try to open it? Okay, good. So upon the test of the cranial nerve number 7, facial nerve, with observation and inspection, his face is symmetrical when symmetrical. It is able to keep his he's able to keep his mouth closed and eyelids shut when I put pressure upon the face, so which indicates that his cranial nerve number 7 facial nerve is intact. So now I'm going to assess for the eyes. So the outer structure Eyebrows are present bilaterally. There's no lesions. Eyelids. There's no lid lag. There's no abnormal protrusions noted. No discharge. Eyelashes are present bilaterally. Sclera. Sclera is white and clear. There's no any abnormal blood vessels present. So, sir, I'm gonna have you look up, okay? I'm gonna pull down your eyes. Your eye. Okay. So, upon inspection, the conjunctiva is pink, and there's no any swelling or any discharge noted. So now I'm gonna assess for the cranial nerve number 7, oculomotor nerve. So pupils are both round and symmetrically round on both sides. The size of the pupils is 3 millimeters. There's no protrusions noted on the eyeball. And then now I'm gonna assess for the direct and consensual. So I'm gonna shine a light on your eyes, okay? Can you look up? So for the direct and consensual testing, his eyes are both reactive to light as they're able to constrict and dilate. So sir, can you please focus on the pen? This is for the accommodation test. Okay. So upon the accommodation test, his eyes are able to constrict when I put the pen closer and able to converge and dilate when I put it away from his eyes. So this indicates that his cranial nerve number 3, oculomotor nerve, is intact. Now I'm gonna assess for the nose. Nose is in the midline. There's no any discharge noted, and there's no flaring noted. Now I'm gonna assess for the ears. Skin color of the ears is consistent with the patient's body. There's no any discharge noted, no cerumen. Now I'm gonna assess for the mouth. Starting with the lips. Lips seems to be moist. There's no any scars, no masses or lesions. Skin color of the lips is consistent with the patient's genetic background. And then now I'm gonna assess for the cranial nerve number 9, number 10, hypoglossal, and the vagus nerve. So sir, can you please open your mouth for me? Okay, can you please say ah?
Ah.
Okay. So upon testing the cranial nerves number 9 and 10, the uvula is in the midline and the soft palate is in the midline. The uvula and soft palate are able to rise when the patient says ah, which indicates that both cranial nerves are intact. Now I'm gonna test for the cranial nerve number 12, hypoglossal nerve. So sir, can you please stick out your tongue for me? Can you move it side to side? Okay. Can you say light, tight, and dynamite?
Light, tight, dynamite.
Okay. So upon testing the cranial nerve number 12, the tongue is in the midline. It's able to move side to side, and there's not any abnormal movements noted or tremors noted, which indicates that the cranial nerve number 12, hypoglossal nerve, is intact. So now I'm gonna start with the neck. So the neck, skin color of the neck is consistent with the patient's genetic background. In the body, there's no any masses or lesions noted. So now I'm gonna palpate for the neck. So upon palpation of the neck, There's no any enlargement of the thyroid. There's no any tenderness. Skin is warm to touch, and there's no any abnormal pulsations noted. So now I'm gonna assess for the carotid arteries. So I'm gonna palpate the carotid arteries. Okay. So upon palpation of the carotid arteries, the rhythm is regular bilaterally. Strength is 2 plus bilaterally. And yeah, there's no any abnormal pulsations. So now I'm gonna assess for the cranial nerve number 11, spinal accessory nerve. So can you rotate left and right, sir? Okay, and you can shrug your shoulders. Okay, go down. So now I'm gonna do the same thing, but I'm gonna apply pressure. Can you please rotate it to the left? Okay. Right. So I'm gonna apply pressure on your shoulders. Can you please shrug it, sir? Okay. So upon testing the cranial nerve number 11, spinal nerve, I would say he is 5 plus on the grade strength, as he's able to perform full range of motion with full resistance, which indicates that cranial nerve number 11 is intact. So now I'm not to roll up your sleeves, sir. I'm gonna assess for the integumentary and the musculoskeletal system. So upon inspection, there's not any muscle deformities, muscle atrophy noted, skin color is consistent with the patient's body and the patient's background. There's not any scar, mass lesions noted. So now, sir, I'm going to palpate your upper extremities. So upon palpation of the upper extremities, there's not any joint swelling or inflammation noted. Joint temperature is warm to touch. Skin is also warm to touch. There's no any tenderness upon palpation. And there's not any masses or lesions noted. So now I'm gonna assess for the radial pulse. I'm gonna assess it simultaneously. So I'm gonna assess it for, let's say, a minute. The rate. So the regular rate of the radial pulse will be 60 beats per minute. It is the strength will be 2 plus bilaterally. Rhythm is regular bilaterally. It is equal bilaterally. The pulsation equal bilaterally. So now I'm gonna assess for the patient's grip strength. So please can you hold my finger, squeeze it. Okay. So upon testing the patient's grip strength, the grip strength is strong bilaterally. They're both equal, which indicates his grip strength is intact. So now I'm gonna assess for the lower extremities of the patient. So the patient has visibly no muscle atrophy. It is symmetrically bilaterally, no muscle atrophy bilaterally. Skin color is consistent with the patient's genetic background and the body. There's no masses or lesions noted. So now I'm gonna assess for I'm gonna palpate the patient's legs. So upon palpation of the patient's legs, there is no joint inflammation noted. There's no tenderness on the muscles. It is warm to touch, and there is no crepitations noted. So now I'm gonna assess for the patient's lungs, the patient's thorax. So sir, is it okay if you lift up your shirt and turn around on your seat? Okay, so he's gonna lift the shirt up. So upon inspection of the posterior thorax, There is skin color consistent with the patient's background. No masses or lesions noted. There is no any abnormal pulsations noted, and there's no scars. So now I'm gonna palpate for the posterior thorax. Sir, can you please take a deep breath? Okay, good. So upon palpation of the posterior thorax, it is warm to touch. There's no any tenderness. There's no swelling or edema noted. No abnormal pulsations. In the patient's, when he takes a deep breath, it is symmetrically bilaterally. So the air is entering equally on both lobes. So now I'm going to auscultate for the patient's posterior thorax. You take a deep breath, sir. Exhale. Deep breath. Deep breath, sir. Okay. Okay, exhale. Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. Exhale. Inhale. 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 Exhale. So upon auscultation of the posterior thorax, the sounds that I hear are bronchovesicular sounds. No ablation sounds noted. There's no crackles or wheezing noted upon auscultation of the posterior thorax. So now, I'm going to assess the anterior thorax. So we're going to assess it for 30 seconds to indicate the respiratory rate of the patient. So respiratory rate would be 16 breaths per minute. Rate would be regular. Rhythm is rate would be 60 breaths per minute. The rhythm would be regular, and there's no working of breathing noted. The quality of breathing would be relaxed. So now I'm going to assess for the cardiovascular system. So sir, is it okay if I lift up your shirt?
Yeah.
Okay. So we're gonna palpate the apical pulse. So we're gonna locate the mitral valve, which is fifth intercostal space, mid-clavicular line on the left side of his chest. Mitral valve will be right here. So now we're going to auscultate the mitral valve, apical pulse. So we're gonna assess the rate for 30 seconds. Okay, we can put it down now. So the auscultation of the mitral valve, the rate would be 60 beats per minute. It is the rhythm will be regular, no abnormal pulsations noted. The sounds that I don't hear is the S3 and S4 sounds. The sounds I hear are S1 and S2. So those S1, S2 is the sounds that are present. So now I'm gonna have the patient lie down as I'm going to assess the abdomen. So sir, can you lie down for me? Okay. So I'm gonna lift up your shirt. So first I'm gonna get the drapings right here. So let me lift your shirt up, sir. I'm gonna drape him like so. So before beginning the examination, we're going to inspect it first. So I would say upon inspection, the patient's stomach contour is flat. It's there's no any abnormal pulsations noted. There's no scars or masses or lesions noted. And this can cause consistent with the patient's genetic background and the body. So now I'm going to auscultate it on all 4 quadrants. So I'm gonna start with the right lower quadrant. So we're gonna auscultate it for 10 seconds. So auscultate the right lower quadrant, right upper quadrant, now left upper quadrant, left lower quadrant. So upon auscultation of the abdomen in all 4 quadrants, I would say the bowel sounds are hypoactive bowel sounds. There are high-pitched gurgling sounds in all 4 quadrants. And yeah, it's present every 10 seconds. So now I'm going to palpate the abdomen. So circular motion like so. So upon palpation of the abdomen, there's no tenderness noted, no muscle guarding noted, and there's no rigidity noted. So this concludes my head to toe assessment.